I run to you. I need your mercy and grace to see me through. So I'll run to you. You are my hiding place. I run to you. I need your
Happy and you know it, clap your hands. If you're happy and you know it, then you really have to show it. If you're happy and you know it, clap your hands. Yes, we are happy that our Honorable Martin Kudo is among us. When I was telling people that the DC will be among us, they wondered and they doubted. And I told them that as for Glowa, there is no way we will invite a politician to our program and that politician will not come. This is the evidence. Let's clap for him. Our collaboration with the various district assemblies that we have been working with in the Volta region has been very, very, very high. And so all the assemblies, whenever we organize our program, we invite the DCE, the DCE, they all participate. And that is a good sign that private-public partnership is working. And we are happy that he is here today. He is interested in immunization of his own children in the district. We are coming from home and we are here to support him, to promote development, to promote good health of his people. And why would he be here? He has to be here, and that is why he is here this morning. And so we are happy, Honorable, that you are here. We have just started deliberating on how we can reach the very, very hard to reach communities with the last child in the last village within your district with the vaccine, so that no child will die out of the preventable childhood killer diseases. And so you are most welcome. And at this point, maybe we'll wait for doctor is coming, the health director is also coming. I don't know whether you wait a little or you'll be interacting with the people while the director arrives. But before you start your speech, I want to give you a brief of what we have come to see in your district. We have been to 10 communities in your district. And according to the Health Directorate, these communities have no immunization coverage for so many reasons. One of the reasons, the first community is Bayon Akwa. Bangol, eh? What's the name of the community?
Banyol.
Banyol is Tinjasi. And that Tinjasi. What's the name?
Banyol.
Banyol. Okay, thank you. Then we have Malanga. We have Jaim Kura. Akura. It's around that one. Yeah, we have JJ Kura. So then we have JJ Kura. Did you write JJ Kura? Yes. Then we have Agbakura. It's also another Lagi. It's another Danladi. You see, I know the community. Then Bango is an Amamakura. Yes. Then we have Teacher Kope. Yes, Teacher Kope. Then Suruku 1 and 2. They are all over bank. Suruku 1, Suruku 2, over bank.
Teacher Kope.
Teacher Kope, over bank. Then we have Isok Crash. Isok Crash. They say they also call it Lempe also, or Lempa. Lempa. That's what call them. And then bling, bling, bling. And that's it. So that one is 1 and 2 and hey, help people, they gave us only one.
So it's
Plan. So these communities are very, very, very hard to reach. Some of them, there's no road. True or false? It's true. There's no road at all. Before you get to Jaipura, we took some pictures and sent them to the road, no road. So we have to enter the bush among the trees. The driver was dodging before you enter that bush. Then when you come to Suruku and then
Teacher Kope.
We travel to Kabomuri with a vehicle. Then from there we took motorbike to the riverside. Then we had to look for more than 2 hours. We were looking for outboard motor to fix on the boat to cross to the Suruku 1 and 2. Then Teacher Kope is also at another side of the river bank. They are not on the same side. So more than 2 hours we were looking for outboard motor. Where shall we get outboard motor? Before somebody decided that okay, he will hide this to us. Before we collected, hide it, and then we went. So one of our major issues to cross the river is the outboard motor. The outboard motor. And some of the roads need to be graded. Like when you are going to Bango, there is a road. According to the community, there is a road. But that road is not motorable, so we have to pass through the bush. Is it Bango? Is that Bango? That's Bango. So they were telling us that there's a road. One of them can just be graded and then you will get them. So that is what we want you to, the grader to come and grade for us.
It's a very short distance.
It's a short distance. So we have to pass and go long, through some bushes, some place. I have to stop and take pictures. So I come and show you. And then I said, next time we are going, we'll go with you.
Okay.
We'll go with you to see how the people are suffering. So that they will see their DC also. They will know their DC. And so we need outboard motor. And then the community health nurses, the challenge they have also indicated is that sometimes they will go and give the static vaccine on a particular day. They are supposed to be going 1 month. Meanwhile, there's one of the vaccines that should be given within 2 weeks.
Of the childbirth.
From birth, 2 weeks, one of the vaccines has to be given. Yet they don't have the fuel to go every 2 weeks. So at least we will be grateful if you will be giving us more allocation for fuel for the community health nurses to be getting there
Every 2 weeks.
every 2 weeks. So that when there's a childbirth, the arrangement is that the people who inform the community volunteer, now we are calling the community champions. The community champion will also call the
Community
nurse,
health nurse.
because the nurses are stationed at
The chip zone.
the cheap zones, where you have your cheap compounds. One is Danladi, one is at Mama Kura, and the other is at Tinjasi, Kabawole, and Tinjasi is also here, and then CB. So you have to be giving them small food so that they can get to the community and vaccinate that child who has been born within the first 2 weeks. Because that particular vaccine, after 2 weeks, it doesn't work again. Meanwhile, that vaccine is very important to protect the child from dying. So that is the nature of the problem. And then there's no light
All the communities.
in all these communities. As for the villages, we can't get there for now. But the main
The chip zone centers.
the chip zone centers, we want you to see what you can do. From now till 2016, what can you do? That will be the plan.
I mean, because the vaccine needs to be kept under particular condition, cold temperature. So-
I sent you a text message. Did you see the text message? That's how I love it. So they will need the light. Doctor,
Doc-
please come and sit there. Come and sit by your. You will need light in those cheap zones, the main towns, and then some fridges, which will keep the
vaccines.
vaccines under the cool temperature. But in the meantime, we know that getting the light in those areas is difficult. So what happens is that when the community health nurse is informed, he or she will have to travel to Pasa and pick the vaccine before going back to the village. That is the challenge. So now what we need is the fuel. They have the
motorbike.
The motorbike. But the fuel to be running up and down is the problem. Without that, then they will not go, and then the children are not covered. And how do you call it? Upanta North District is among the 20 non-performing districts in terms of EPI. That is the immunization. So we don't want Upanta North to be rated among those 20 in the next 4 years that Global will be working here. We want to cancel our names. This district, we want to cancel our name from those 20. Out of the 216 districts that we have in Ghana, Pantano is also part, among the 20. And so we want to cancel in the next 4 years, we want to cancel Pantano from the low performing district in terms of immunization. And I believe that our honorable DCE will support us. Even if there's no money, we will go and borrow us some fuel so that we will go to the community. And sometimes we need extra motorbike or vehicle when it comes to the national immunization group. I want to give us support. So these are the challenges we came to find in the various communities. My dear Commission of Nurses, have I covered all the issues here? Have I?
No, saying this teacher is a root date, but we have to. There are some bridges or covers that have been constructed before we can have access route to the place. Other than that, then we always have to. Other than that, we always have to use the boat. So if those where the streams and those stream pass, so we have at least 3 or 4 streams on the road to that place. So if those covers can be constructed so that it will be more travel, then
Crossing through the
better option than going on
the river.
And also concerning water issues. Water issues. You live in there and you don't get water.
Potable water.
Potable water.
So talk about drinking first.
To drink before you bath, you don't have water. And toilet facilities is very poor. You don't have it at all. You have to run to the bush before you make yourself fine. And the ladies who are in the communities, they can't be doing that. it's only the guys that can force ourselves and we're doing that. So if something can be done to provide toilet facility and potable water,
cheap compound, at least cheap compounds.
And also potable water so that the place can look convenient.
Okay. Yeah. Thank you. Thank you.
Great. So I think we have captured all the issues, and we will give the opportunity to our Honorable DC. When is he on the program? We want him to tell us about mobilizing support for comprehensive immunization program in Kwanta North District. The true commitment of the Kwanta North Assembly to achieve at least 90. If we don't get to 100, at least 90% of our target. So now we'll give him the opportunity to interact with us. With a round of applause, let us welcome
Okay, so hello.
Hi.
Oh, my voice is very
Okay.
So let me start there. So the issues and the concerns that everyone has raised is very, very key, very, very important. Let me first start with that in the health delivery system. Now everybody's talking about private PPP, private public partnership. Okay, Ghana Health Service alone cannot truly reach out to people. That's why we need important partners. And one of them for coming in Kwanta North. Not everybody will come and be as involved as they are doing. And they have come and they are very eager and they have acquainted themselves with the activities of the district. So first we congratulate them and thank them for coming. So and secondly, a number of issues have been raised concerning why in Kwanta North we fall below the performance target of the region. And all that you have said, are key to them. But before, should I say, in terms of the district, this is our president. Okay, and in terms of the district, I may be, in charge of health. So I'm coming in to give some of the solution before he gives the State of the Nation address. So there are two reasons why we are not doing well. The first one is logistics. The second one is attitudinal. Okay. The first one is logistics. The second one is attitudinal. The logistics one is the one that we've all mentioned. Where we are is very, very, challenging. You have to go over bumps somewhere. Many people are farmers. If you don't communicate well with them, you go and you not meet them. So these logistic challenges, things like fuel, things like motorbikes, things like a vehicle, they are one of the big challenges. Someone mentioned we don't even have water, we don't even have places of convenience, and it goes beyond you alone. I'm sure even if you look at the whole town and you are looking for ratio of population to correct WC project ratio, it will be low. And these are all genuine issues that we've taken in. On the other hand, some of you here are doing very well. Some others too, if you check their reports, they are not making an attempt to go to be on the outreach. Are you with me?
Yes.
Some people have declared some parts of their catchment area as it's too far, I will not go the extra mile, motivation is not there, why should I even go if I am low performing? Would I be punished? Would I be transferred? Because there's nothing like that. People have become relaxed And I think last 3 weeks we went to our annual performance review in the region, and the region awarded a lady called Mercy Mensah, who died 5 years ago. She was a community health nurse. She passed away while she was delivering, and they gave her an award 5 years to the family. Why? This lady was a community health nurse who was extremely, dedicated to her job. She would take her bicycle, and she was at Azua. She would take a motorcycle, go to places, that people will not go, and try and get all these immunization things. Well, when CHIPS was first introduced, she was around, and she was instrumental in getting this CHIPS, started. And unfortunately, she even died in the line of duty whilst serving her people. And even 5 years after she had passed away, people still feel that it's not enough going to the funeral, it's not enough presenting something. We should give an award to the person. And then an award was given at the regional level. When we came back, we have instituted, Mercy Mensah Award that we are going to give to community health nurses that do their work, and go the extra mile, okay, to let that legacy stay, and also to serve as, an encouragement for those who are working. Because at the end of the day, even though the remuneration will not be enough, your good name, and your reward with heaven, as they always say, for health and teachers and public sector workers would live on. Then the other thing with fuel and things like motorcycles, and when I went, we told them in the last 2 years, we've not received, not only us, the whole of Ghana, the districts have not received the usual support in terms of financial, from the government. However, even though they is not given, we've been using some of the IGF and the insurance, to do some of the work that is being done. Sometimes you've had some of the leaders in the community donate bicycles and motorcycles to us. You see, donated by this, coming from the leadership from the districts, and things like that. A key thing that has hindered effective planning that everybody would agree with now is the irregular payment of national health insurance. I mean, I'm sure as you go back and give feedback, I want you to see that this is the effect of us not being paid well or on time. The last time it was paid was on June last year, to date. So if even we are going to use some of the our payments to say buy a bike, the money has not even come for us to do that. If we are buying petrol, after some time, you owe so much that going for extra is so it's after some time it hinders the work of genuine community health nurses who are willing to work. And I mean, there's a part of the national health insurance that the MP commits to health activities. Okay, in conjunction with us and the district, we decide, oh, let's use it to do this. Okay. If that money hasn't come, and we say that, oh, if that money comes, we buy 5 bikes. The money doesn't come, the 5 bikes will be on paper. So the people here are generally committed and are working hard, but there are other big factors that the whole of Ashanti region are meeting to complain. Even in Volta region, the Volta regional director held a press conference and said that the the core payment of health insurance is affecting the region. Okay, and we're promised that the insurance will be paid in 2 weeks. The 2 weeks ended on Friday, and nothing has been done. So these are some of the challenges that are in the system. With the attitude, I can say 60% really are committed. 40% have the right, have the motive title, but they won't go very, very far. Okay, am I lying? Some people, you go and, not everybody goes very far. And it's not just about, say, I'm going for immunization. You have to plan. You have to see your volunteers. And I think these are the strategies that an NGO like yours will give to both the community organizations and the volunteers, that sometimes your poor entry of the community would reduce
patronage.
If you don't time it well, maybe you have some warnings to do in Kasa or anything, or you put it on this day, that day is close to some harvest or this, they will not show up. So we also have to put some extra, strategy into how we get people to come. And when we put a strategy inside, a lot of people will come, and then we'll also be able to give the immunization. We are not in a place where people are afraid of immunization. You go to like Nigeria and Pakistan, even if you go there, they will not agree. For us, the people are willing. So the thing
was given a district before we had electricity. And then it passed down from Kusri to Punacha, right? Punacha. It did not extend to any other place. Because the hard work of our president, His Excellency Dramani Mahama, he is working to make sure that every rural area is connected. Because if you don't have light, facilities like immunization and then improving the health care of any individual cannot be achieved. Like you mentioned, drugs needed to be stored in the good temperature. It might be stored in the fridge. Then how we store them, we don't have electricity. So the government has done well, and as of now, we have about 90% of our rural areas which are connected to electricity, and then they are waiting for commission. The place, if you get to a place like Suruku and those, they are small communities that have not been privileged to enjoy this national day. But I think within the second phase, will be considered. As of now, we have added about 50 more communities. 50 more communities have been connected. And then we have added 22 communities, which I don't have the list. I will have made the names available to you. And that is not to say that all the communities that you mentioned here are going to benefit. No, not all of them, but some are going to benefit. But as you know, development is not a gradual process. To add up to what I've said, if you are working, sometimes you need to sacrifice. You might not get all that you need to deliver. But once you assure yourself and took an oath that I am ready to work for Mother Ghana, that means that you must work, you must make an extra move to make sure that you reach and achieve your target set for yourself. I want to refer to what Doctor said. Madam, you will be able to get those places and then giving a report that you will not be able to capture a lot of things. I think we cannot provide that within a lot of time. But when you came, you put up on yourself, go to that places. So I want to urge the medical team that even though you cannot get all those things accessible to you now, but make an extra move like Madam has moved with her team, so that if it's a immunization day, those children will be covered. They will think about how to provide all the facilities that you need. With the chief compound, you can achieve better health delivery if you don't have chief compound. In contact of you don't have a medical, you don't have a hospital, a big hospital. We don't. But what do? We need to provide certain basic health facilities. In my office now, we have finished constructing one chief compound platform. It will take care of our bank and other surrounding communities and with Tempora. Then you go to, we are putting another one to at Lamina. If you get to Ugunja and Lamina is very close. But we don't have enough facilities to provide those things there to go. So we are putting one cheap compound lamina. And very soon there is a road in terms of road connectivity. You see, there are culverts that constructed. If you go Obunja, from the road to Obunja, there's a culvert that you cannot cross the town. Now we have advertised, and the contractor will put the two sides very soon. So very soon they are going to start work on that. And then with Dongo Kuraru, thanks to God, we have our partners, development partners like GSOP. GSOP has taken over that site. And then we had a meeting. What was that? I think last week. It was last week. We had a GSOP program last week. And the engineer Siri is going to resume work on the site. And very soon we are going to open up the Dongo and Madam, once you have come, I think you have come timely, and I will hope we maintain this kind of relationship. Certain things might not come to our mind easily. Anything you want to, anything I want to undertake this program, let us have a discussion. How do we assist you? You mentioned getting to places that cannot be reached. You need fuel, you need many things. Let's come together, we discuss. Okay, to plan who are going this way. What and what do you need to the plan? I think we can also make it. If other places are making it, we can make it. We can make it. It is the challenge you and I. Let them prove the world that we are also making it. And then you are going to achieve that the disassembly, the credit has not come to the DC nor the doctor. It's come to you, the workers. So let us work together as a team. Let them be the priority of all of us. Like Dr. mentioned, we are developing a package. We want to work at a rewarding, hard-working staff. Yesterday, something happened last week at Ago where they were killing some people's animals. I don't know that is correct. I slept around 2 o'clock last night and wake up early morning to go there. There was one military officer, I just was master, I wish I have a own. I would just increase around this and that. Because this gentleman never slept. Every time he's going up and coming out, going to the bush and coming out. All that has been done, perfectly. He didn't need anything else to do that. Because he had promised himself that as well as this is what I want to do. He has done it. He does not need extra than, he does not need extra listen to do it. So my dear brothers and sisters, I think it's a challenge to all of us. Let them appeal the image of Kwantano. If Kwantano will be in the good of the country, it depends on you. It will not be, it will depend on you. Nobody will come from anywhere to grow this place apart from you and I. It's our challenge. I think together we can achieve the goal that we are all desiring for. Thank you for that. I will not be able to tell you how committed will be and we know the quantum of whatever we are demanding. It could be, if you say, okay, in a month, we will fuel 1 or 2 bags on relative. I don't know whether it will be okay or not be okay. If you can get maybe a proposal of what you want to do, then we tell you, okay, this one we can also have, I think we will have. So I'll be grateful if you allow me to also ask the taxi. Let us have your schedules, your plan, your schedule. And then you put in a form of proposal in a month. These are what some of the activities you want to undertake. Then I will discuss our management team together with your medical team, and then find out how best I can also help.
Thank you.
A 1 month old, but some of these things are coming to me as news. But Dr. Drew is just a new man. This problem of not having it. Some of them, I'm out somehow, some too are just used to it. Our brother talked about the business of solar like that.
Yes.
Some of the people.
Contact.
See, the difficulty we have is when I Zoom office, and people from Kamari and from other communities, even the schools, they were giving solar panels. I don't know how they do it. They allow people to go there and then people went and stole all the things. They stole all the things. They feel like I don't know whether you have read the news. People went, they stole everything that was provided. And before you get this, you have to apply to the Ministry of Energy. It takes a process before you are given one. You will not apply when you are given. You take a follow up before you are given. So when you apply to one of the agencies, and they are sure as of concernment. So for now, we have not received them yet. If they come, I think, if they come before the commission of the agency, you will give them. But let's bring the commission come, because they are almost done with everything. We are only waiting for the contractor to hand over the key to the government, so that we just open the light. They are done with everything. What point they are done with it. And we have talked about the toilet facility at T compound. See, there's one thing I came to inherit. Not only at T compound. We have problem or difficulty in putting up our own toilet facility in our houses. Pasa, if you go to Pasa here, about 70% of the households have no toilet facilities in the house. I don't know whether I'm correct. People prefer the fluid method of thing. And then we don't have enough water here. We are battling with what we have from Dangote water supply.
Give me one.
And the most of our people are still lying solely on River Pasa. So you go to toilet, you go to fluid, you do your own thing there. It rains, it washes everything into the same. Then you follow up the same thing and bring it to the house again to use. That kind of recycling thing continues. And then you know the related disease, typhoid and other related diseases. So it's something, and then as well because of that, we pass a bylaw that by May, each household must have a toilet. It's something that we are insisting on. If you are putting up a house now, you look at the plan, if you don't have a toilet facility, will not allow you. Even if you are putting up an apartment house, you don't have a toilet house, will not allow you. So we are tackling from that level. So with the toilet thing, I think we'll see how best we can do. And the new T compound that we're going to construct, we factor the toilet facility into it. Because this one has already occurred. But the new ones we are commissioning, we make sure that they provide the toilet facility. And someone spoke about motor bikes. We need motor bikes. I have been very glad if you come school me small in that aspect. The motor bike, I don't know whether they were provided by the assembly or it was by the ministry. So they know how to tackle it. The motor bikes.
What we are using is for the ministry.
I'm asking those who were provided by the ministry.
Yes.
So your plea is that assemblies will help you
Yes.
support you. Okay. Jungle one. Okay. So connect the letter. Take note of it. Then we have Delari to Abakra. Yes. I'm aware that place is not open, especially during the rainy season. But there's a way out. If you are going to Kujitapra, there are 2 routes. You pass through Makura Road, you pass through Lamina. But Lamina, I don't think you cross through before you get there. Do you cross through? So, Ukija, they are mentioning that they cannot cross during the rainy season. There is an alternative route. That is magnified. But I think on the interior, once we don't have all that we needed, let us sacrifice more. Let us sacrifice. If you feel this is an alternative way of doing it, and you think it will cost an extra, let's come forward and discuss. We'll find a way of resolving that issue. Than leaving a time that it must cost me so also not doing it. We know it is our duty to construct that road, but for now, I will construct it. But it's a way out. So let us use alternative that solve the problem rather than relying solely on what we need to have before we do it. And we have both of T compound. Okay, we're going to look at the struggle I'm battling with the common heart and feeling, they assured me of some number of goals. So I am really follow up. So let's pray. I might not be able to give all the cheap compounds, all that we need. I am not be able, but at least.
Because they are the most deprived.
Yes, yes.
This project.
A project community.
Yes, the cheap compounds.
Yeah, that's what I'm saying.
There are only 5.
Yeah,
They are fine.
yeah, 5.
5. So it should be the top most
Priority, yes. So we have 10 boreholes and then 2 mechanized ones, making 12. That's what I'm fighting for. Let's pray if it's approved. I think 5 will not be more than this.
Yes.
You can squeeze 5 out of them and then give to you. Let's pray.
Thank you.
And I think provision of polytons. If I were to get this, it will take care of the polytons. For now, I will not be able to promise you that today or tomorrow I'm going to give you a polyton. Let us pray. Let us work on the water, the pipe, borehole that is in the pipeline. So that we try be where we can push it to. I think if you please, we'll be able to see where we have reached now. I am done with the questions, or if there's any question someone raised and I did not answer, then I think you still have the chance to come on the floor.